Thank you guys for your questions on breast lifts and breast reductions. There were some really good ones. Like I said before, I'm sorry I'm not able to answer more personal questions because that establishes a physician-patient relationship, and I'd be happy to answer those questions in consultation. The phone number is in my bio. So without further ado, age for a breast reduction. So ideally, you would like the patient to be done growing. However, there are special circumstances where the patient is younger and they just really have large breasts or gigantomastia, so they really need an operation, but the biggest risk being recurrence. Breastfeeding after a reduction or a lift. So the literature shows that after massive reductions, some women are able to actually breastfeed their baby versus if they wouldn't have had the reduction in the first place. Usually it's due to the size of the nipple areola complex, or it's being too large for the actual baby to latch on. So after a reduction, usually they have an easier time breastfeeding. T-incision versus periolar, so around the nipple. The reason you don't see periolar incisions as much is because usually when people come in for a breast lift, the periolar incision isn't going to give you that actual lift. You need more of a T-incision or anchor incision to get the lift that you want. Specific age for a breast lift, the age at which you feel like your breasts aren't gonna tighten back up. Upper pole volume is an implant the only solution? So no. So I recently did a breast lift in a massive weight loss patient and used no implant. I used her own tissue, by creating a large pedicle and shaping the pedicle and actually suturing the pedicle higher up on the chest wall. I was able to establish nice full looking breasts to the point where she almost looks like she has implants, but it's totally her own tissue. Let's see. Do you lift after fat grafting? So if you want more upper pole volume, you can do fat grafting, where you basically do liposuction, suction out the fat and place the fat within the breast to give more volume. I routinely do those in breast reconstruction patients, but it could be done in the cosmetic setting. How many years does a lift last? Approximately 10 to 15 years. So it's based on your own anatomy. Gravity is always going to win. The ligaments of the breast, Cooper's ligaments, do stretch over time. But typically the literature says between 10 to 15 years, but every person is different. Let's see, multiple reductions recommended. So I do not recommend multiple breast reductions. I think that is a cause for concern that not enough tissue was removed, or the symptoms you're having may not be from your breast. As you do more reductions, you risk devascularizing your nipple, and which could lead to nipple loss. So difference between a reduction and a lift. So a reduction, you're taking away breast tissue to take away weight, which alleviates back, neck, and shoulder pain. With a lift, you're just, cosmetically lifting to give that breast a more aesthetic look. With a reduction, you do get a lift, but you also lose volume when you do a reduction. Do you always have to do free nipple graft? So a free nipple graft is where you actually take the nipple off the breast and place it on like a skin graft. Those are only typically seen in massive breast reductions, to the point where the breast is very large and very tonic, meaning very saggy, like, down to your belly button. So usually, you really don't see free nipple grafts, but the patients that have super large breasts that are very tonic are the ones that you have to, consider doing those free nipple grafts, because when you do the reduction, the risk of the blood supply not being there to supply the nipple will ultimately compromise the nipple areola complex. Can you do breast lifts with tummy tucks? Yes, it's routinely called a mommy makeover. You do have to be advised that there are increased risk when you combine procedures, but it's routinely done. A lot of people get liposuction, a tummy tuck, and a breast lift all at the same time. So it can definitely be done. Let's see, loss of volume with a lift. So with a lift, you don't necessarily, you can lose volume, but usually routinely patients that get a breast lift are really deflated, so they don't have much volume at all. However, sometimes there are ways that you can take what they have and create more volume, which is what I did with a massive weight loss patient. A lot of times people supplement that loss of volume with an implant, which increases complications, but it gives the patient the look they're looking for. Candidate for an implant versus a implant only versus a lift. So like I was saying, if you have loss of volume once you lift that breast, then an implant is a good way to go. Sometimes you can do total autologous reconstruction where you basically use their own tissue to, make them more full without an implant, but you usually see that in massive weight loss patients. Looks like that was the last question. So thank you guys for all your questions. I really appreciate it. I think the next topic should be tummy tucks or abdominoplasty. So submit your questions for abdominoplasty down in the comments below. I'd be happy to answer them. Thank you for these great questions. And as always, if you have any more personal questions or would like to seek a consultation, the number to my office is in my bio, and I'd be happy to talk with you. Until then, stay safe, and thank you guys for tuning in.